Good morning, everybody. I'd like to welcome you to our provider press conference today for the 1B vaccination process that will be launched next week. The process today will open it up with Abby Buckup from the EMA to discuss the EOC Emergency Operations Center and the role that they are playing and all the help that they're providing.
Thank you. Good morning, everyone. My name is Abby Buckup. I am the Director of Lucas County Emergency Management Agency, and the Lucas County EMA assists the Lucas County community in preparing for, responding to, and recovering from disasters. The Lucas County EMA, we work closely with both Ohio Emergency Management Agency, the Federal Emergency Management Agency, as well as local government, public safety agencies, and other stakeholders within Lucas County. One primary role and responsibility of the Lucas County EMA is operation and management of the Lucas County Emergency Operations Center, or EOC. And the EOC is essentially a multidisciplinary, multi-agency hub that supports a lead agency during the time of an incident or a disaster. We provide coordination, information sharing, specific to COVID-19. The Lucas County Health Department is serving as this lead agency, and the EOC is a supporting role to their response to COVID-19. For COVID-19, the Lucas County EOC activated on March 13th, 2020. Today is day 307 of our full EOC activation for COVID-19 response in Lucas County. We have supported in multiple roles throughout COVID-19, to include coordination of COVID-19 testing, isolation and quarantine housing. The EOC has a very robust logistics section. Early in COVID-19, when scarcity of personal protective equipment was at its height, the EOC's logistics section coordinated receipt and distribution of PPE from the Strategic National Stockpile. The EOC has continued to distribute PPE to law enforcement, fire and EMS, hospitals, and other healthcare agencies in Lucas County to reduce the spread of COVID-19 among frontline workers. We have also distributed almost 900,000 face masks to the Lucas County community through partnerships with various community organizations such as TARDA, Lucas County Metropolitan Housing Authority, Neighborhood Health Association, as well as the Toledo-Lucas County Homelessness Board. We have also distributed masks to all of the Lucas County subdivisions for them to distribute to the populations that they serve. All of this was in an effort to encourage mask use among those that live in Lucas County, those that work in Lucas County, and to encourage them to wear masks and to minimize further community spread of COVID-19. Now that the federal government has approved both the Pfizer and the Moderna vaccine, use of that for vaccinations for COVID-19, much of the EOC's efforts are in support of the health department's mass vaccination for COVID-19. Beginning next week, Ohio moves into vaccinating the phase 1B group. So I will turn it over to Dr. Skoczynski to provide a little bit more detail on what that phase 1B implementation will look like in Lucas County specifically. Thank you.
Thank you, Abby. Appreciate that very much. What a great partner the EMA is with all that we're doing for the vaccination project here. I need to make sure that the community understands that the health department is dedicated to making sure that we prevent disease in the community, that we're keeping as many people as healthy as possible in these current conditions. But more importantly, that we are dedicated to making sure that we get these vaccines out to individuals in our community as fast as possible, because the more vaccine we get out, the quicker we can, the better it is for our community, the less spread we're going to have, and the faster we can get back to our normal lives. We've had extensive experience with mass vaccinations. Matter of fact, every year the health department does mass vaccinations for our community relative to child immunizations. We've been working with federal partners for the last couple of decades on training and exercises, but I think more importantly, we've actually have done mass vaccination in this community. It's done very well during the time of H1N1. So again, we have experience, we have the knowledge, but more importantly, we have the partnerships that are built to make sure that we can go ahead and vaccinate as many people as possible as quickly as possible. We are well equipped in this community. Again, not just public health, not just EMA, but those partners. And we'll be talking about those partners and providers here in a second. But what I really want to get to is what are we expecting next week? We are expecting to start vaccinations in that 1B category, specifically those 80-year-old and older individuals. That's what's going to start next week. After that, we'll be moving into 75 years and older, those with severe congenital development and early onset medical disorders as well. Come February 1st, we're looking at 70 and older, and then this is important too. We're going to be looking at how to get vaccines out to our K through 12 schools that wish to remain or return to an in-person or hybrid learning. That's important there. And then by February 8th, we're looking to start that 65-year-old and older group as well too. I need to make sure that I preface this. This is really important. There are 2.2 million individuals who are eligible for that 80-year-old or older vaccination in our community, or excuse me, in our communities in the state. So that is that 1B category. That's really important to understand. 2.2 in that 1B category. So we're going to have limited vaccines over the next couple of weeks to do the 80-year and older and that other remaining 1B category. So again, you're going to have to bear with us. I know everybody in the community really is intent in trying to get the vaccine, and we're going to get it out as soon as we get it. So those vaccines are in short supply. The county allocations are expected to be in the hundreds, not the thousands, over the coming weeks. That demand is very high because again, that supply right now is throttled down. It's not coming as fast as any of us wanted to. But as those supplies increases, we're going to be, of course, being able to get more people vaccinated. So again, we're setting up a process to make sure that individuals can get vaccinated quickly. This process really has been a little bit different than what we're used to in for our planning purposes over the last couple of years. It's now been directed by the governor and the Ohio Department of Health to actually be able then to get these vaccines out to the community as fast as possible. And so we're going to start using providers for that. These providers have been pre-positioned inside the community. They've been chosen for a number of different reasons. A couple of those reasons are, of course, the ability to get the vaccine out. Also then to what we call throughput. And really throughput is the ability to move people through these vaccine providers quickly, these clinics. So again, that is why they are chosen. These may change, and I'm sure they will over the next couple of weeks as we begin to get more vaccine in, but again, understand the community a little bit better and where these are pre-positioned. So how do you actually get to one of these facilities to get your vaccine? I think that's important. So you're going to need an appointment. You must schedule ahead. There are no walk-ups, please. No walk-ups. That is not going to be an ability for us to do right now. You must live or work in Lucas County to qualify for the vaccination. You need to wait for your group to start as well too. So again, unfortunately, if you're 79 and you show up next week, we're not going to be able to vaccinate you until the following week. So you're going to have to wait till your phase starts or your age group starts. Again, we really want your patience on this because again, we're trying to match up the short supply of vaccines with everybody who wants it. Last but not least, the ID is going to be required. We need you to bring some sort of photo ID or some document to again, make sure that you have proof of age for that group. Because again, we want to make sure that we do this so that everybody in the 80 age group, 80-year-old and older age group can go ahead and get their vaccine with the vaccine we have in the community, and then we move down the list. The thing about the scheduling too, where are these sites? And I think that's going to be important as well too. We have 7 providers throughout the community at 23 different sites. So again, trying to make sure that we knock down as many barriers for you to get your vaccination. Let me just read these off to you. Again, you're going to want to get onto the Lucas County website where, again, you can go ahead and start registering for your vaccination. So Riverside Community Health Center, Rams Health Center. There's a number of different Krogers. Again, please, as we'll talk here in a bit about the link, there's a number of different Krogers in the community. Mercy Health, ProMedica, University of Toledo Medical Center, and then McLaren St. Luke's. So again, registration information for these providers will be available soon on our website. There's also going to be an interactive map. So to make sure that, again, if you want to go ahead and look at the map, you'll be able to then pick your closest spot, and hopefully there's a time slot for you to get your vaccination there. What's going to happen is when you get to our website, you're going to be able to go ahead and actually hover over the area that you, or the provider you want to get vaccinated at. It's going to give you a lot of information. It's going to give you the ability then to go ahead and click and get the link to the registration for that facility. So again, we're trying to make this as simple as possible for the community. The idea then here too is, we understand that the internet can be tricky for many individuals, but especially as we look into the older age groups, some people might have some real issues, but not just issues with getting on the internet. So we understand this. So we've set up two of our partners and great partners, United Way 211. This is specifically for getting any special assistance you might need, multilingual support. Again, they're going to help you register. So again, that's just for what 211 is for right now. If you are 65 years or older, as the time comes for you to get vaccinated, go ahead and go ahead and call the Area Office on Aging at 419-382-0624. What's going to happen here is that they're going to be able to help you with anything for those 65 years and older. So again, I really want to stress this. Utilizing 211 if you have some special assistance or multilingual support that's needed. But if you are 65 years and older and need any of those issues too, please call the Area Office on Aging. I want to also stress too, we don't have unlimited support for this. This is a resource. So we're asking you to utilize 211 in that way in Area Office on Aging. With that said, Area Office on Aging, another great partner, I'd like to introduce Aretha Holly, who is the Director of Medical Education for the Area Office on Aging.
Thank you, Eric. My name is Aretha Holly, and I am the Director of Medical Education at the Area Office on Aging of Northwest Ohio. I am a pharmacist, have been for 53 years, starting in June. Most of that's been in the hospital setting, but I'm privileged to work there now. And the Area Office on Aging has had a long history of service to older adults in Lucas and surrounding counties. We are very familiar with the needs, the concerns, and the barriers that older adults face, but we are excited to be at the table to assist with this vaccination rollout. Our role is to connect and assist the older adult with those who actually are going to be getting the vaccinations or the shot. We also are going to be available to provide help when possible with any other supportive needs or services. The older adult is more vulnerable to COVID-19 than any other age group. As a matter of fact, 1/2 of the deaths that occurred in the state of Ohio from COVID-19 were attributed to this group. The vaccine has proven to be safe and effective, so we are encouraging everyone to sign up for the vaccine when your group comes around. We also will be helping those who cannot make the appointment themselves to make the appointment, and to provide education by answering questions that you may have about the vaccine, dispelling myths by providing facts, rather than speculation. We have a great staff that has been over the years believed to be very trusted. We're well positioned and we're ready and willing to assist you in any way that we can. So if you need help, we invite you to give us a call. Thank you.
Thank you so very much. Again, great partner. And we look forward to working on 65 years and older over the next couple of weeks with you and making sure that we get as many people as vaccinated. I want to make sure that this is clear. So what we're doing right now is that we've set up through the Toledo-Lucas County Health Department website the ability for us to click on a link that will take us to where you can go ahead and get vaccinated if you so desire to be vaccinated, 80 years and older. And again, there's 23 different locations where you could go ahead and get vaccinated. So again, if you're able to go ahead and get on that website, go ahead and click on the link. It'll take you to where you can get vaccinated. Again, if you cannot, if you're having any barriers whatsoever, we've talked about United Way, and we've also talked about 211. So phase 1B scheduling, we have the providers. Here's our link. Again, full list of providers will be provided for you. Again, we've talked about the interactive map. It should be straightforward to be able to get onto the website to be able to register. We have United Way 211, again, for language assistance or other assistance. And then please, Area Office on Aging, please give them a call. If anybody 65 years old or needs assistance, 419-382-0625. Or excuse me, 0624. That's 419-382-0624 for 65 years and older. I think what we need to do right now is still be very vigilant to COVID. Yes, this is great that we have vaccines coming into our community, into the state, and in the country, and actually worldwide. But we do not have the option right now or the ability to let down our guard. So we still need to do those things that we've talked about for a long time now. Wash our hands. You need to continue to provide good hand hygiene. Social distancing, again, we've talked about that, staying 6 foot apart, not going out into crowds. Wear your mask, please wear your mask. Even if you receive the vaccine, you still need to do these things. You need to wear your mask, social distance, wash your hands. I think the last point is so important. We all need to stay informed. This is what we did today. We provided the education, the ability, the knowledge to get vaccinated. The idea here is we continuously need to make sure that we're staying informed to stay healthy by accessing as much information you can about the vaccine, about COVID, and how to stay healthy. So with that said, I'd like to open it up for questions to the media.
Bree from Channel 24 has a question.
Bree, go ahead.
Hi, can you guys hear me?
Yes, Bree.
Perfect. Just curious, how many people have pre-registered in the county so far?
So again, that pre-registration we launched last week. That is still operational. That does not set you up to get a vaccine. What that is doing is allowing us to plan how many people. So we have 44,000 individuals who have actually signed up for that pre-registration. And that's amazing. And so we would urge everybody to still utilize that so that we can go ahead and keep our planning.
Melissa Bates with Channel 13 has a question.
Yeah, good morning. And just to clarify for people, even though I've signed up on your website already and registered, I still need to go and make an appointment, correct?
That is correct. And thank you, Melissa. Yes, that is correct. We'll be sending out, for those that have given us their emails, we're sending out information, how to sign up. So that's a very important aspect of that pre-registration site. But yes, it does not enable us then just to pre-populate your registration. You are going to have to come back again and register with that provider where you want to get your vaccination.
And people will they get a communication from the health department telling them, because everybody's wondering how they'll be notified. So will they get that from the health department?
So we're hoping that, again, we're utilizing this platform with our great media partners to get this information out. Those that have signed up for pre-registration will receive an email from us. The idea here, though, is that on our website, you'll be able to, again, click on the link that says for vaccinations to be able then to go to wherever you want to go to the vaccine. And again, I know I'm probably repeating myself way too many times. This coming week is 80-year-olds and older only, 80 and older.
Okay, I'm sorry.
No.
It looks like we're going to be, we're going to be in 1B for quite a while with the number. How many people do we have locally in 1B? And it looks like it's going to take quite a while, just judging by the supply of vaccine that we have.
Sure. Melissa, you make a great point. Let's just look at those 80-year-olds. From the census, we're looking at about 15,000 individuals. Again, that's just our planning. We're trying to tease that out of, are they in long-term care facilities? How many? So again, that is why it is so important that these doses, these doses are very precious right now. And that's why we don't want to waste them. We want to make sure that as many doses for next week into those 80-year-olds and older. So
Amy Steigerwall with Channel 11, please ask your question.
Hello, just to clarify the dates and times one more time. Next week, 80 and up, and after that, whenever that's finished, you're going to move on to 75 and up. February 1st, 70 and older, and then February 8th, 65, and that is when you're going to start the schools as well. Now, when you say schools, is that, is that teachers, is that employees, is that students, who's in that school category?
Sure, great question. And I think we have the graphic back up. The idea here, if you're asking about schools, we are looking K through 12 only. And those individuals would be the teachers and the staff who are actually in those schools. But please make sure at this point in time, the caveat here is that those who can receive the vaccine are those that want to remain in school full-time or in a hybrid learning type of process. So again, that is being worked out through the governor's office and all the schools in the state of Ohio.
And like Melissa was pointing out, the process, getting through B seems like it is going to take quite some time. Have you guys been given any indication as to how fast more doses will come into Lucas County? It seems as if, it's kind of a day-by-day thing. Is that still where things stand?
I would have to say for our planning purposes, that is correct. It is really day by day. As we talk to the governor's office, again, they can anticipate deliveries. And the numbers that we've heard are between 100 and 150,000 for the entire state. I do believe, again, I want to make sure that this gets through the community. So again, we don't lose hope or, don't still be engaged and excited about the vaccine and helping our community. Eventually, more doses will be released as new vaccines come online. But also then too, there is indication that both Pfizer and Moderna will be releasing more doses later on in the year. So again, we just need to make sure that we work through the process that the governor has set up for us right now to be able to get as many vaccines and as quickly into those individuals who want to get the vaccine.
Caitlin Durbin from the Toledo Blade, please ask your question.
Hey, Eric.
Hey.
So everyone is saying that they're committed to ensuring that all of these doses are distributed with each shipment. And I know the state has said that supplies must be used within 7 days. So how is the department ensuring that that happens? And are there so-called no waste lists that people can sign up for if doses are available?
Okay, let's tease that out a little bit. First off, we're working with our hospital providers. There's other providers on that list that are private industries. So those are a little bit harder. Our hospital systems have come together and said, we're going to work on this as a team. And I think that's what the community really needs to understand. So we're working with them to get those individuals registered into them so they can get the vaccine. And as we go through this process, you talked a little bit about waste. That is really important, and it goes hand in hand with getting these vaccines out quick. I know the governor said, I do believe 7 days. The idea here is, at least for us, within 5 days. Actually, we would like to get them down to 24 to 48 hours if that's at all possible, so they don't sit on the shelves. Because again, we want to get them out. The waste. I know from our clinics that we've run from the health department that we have not wasted one dose yet. In the community, I've not heard one dose wasted. I know other communities have. So what we're trying to do is, if we do have doses that are going to look to be wasted, those providers have the ability then to reach back into the population to go ahead and get them in the 1B. That's our primary list, if you would, of individuals. Then you have the secondary list where there still could be some 1As out there that need to be vaccinated if it's a waste dose. And so we are working on that very process to see how we can, again, work together if anybody does have trouble. But I have not heard of one individual having issues with waste.
Bree with NBC 24. Please ask your question.
Hi, just another question. Again, Eric, if you don't mind. So, how are either the health department or those providers going to determine who is eligible within those groups? So is it going to be a first come, first serve? If we only have a certain amount of doses to not cover that entire group, whether it's the 80-year-olds or all the way down to when we get to February 1st with the school personnel, how is that going to work?
That's a great question. Again, right now we're looking at those providers to again get their own list together, because they know their population that they need to vaccinate if need be. As we go through this process, all right. Again, this is always ever evolving. If on our almost daily conference calls, we'll go ahead and look to say, do we need to get a centralized list? Is that something that's needed? So we'll be working on that as well. Again, it's always ever changing. And that's the problem with this. We plan for something and then it changes. So we pivot very quickly. I want to let the community know the work that the team has done over the last, really, let's say 3 or 4 days. We just learned about this new process about providers being used, because that was not our plan. Hospitals came together, many different departments came together really within just the last, let's say 3 days, and have developed this plan that we've rolled out today. So again, we're getting very good at pivoting with all the new things that are good ideas, I think, to be able to get these vaccines out to the community.
So as of right now, would you say that it is like a first come, first serve of whoever is already signed up?
Yes. Again, that is exactly true. I really do want to stress, and I want the community to know that we do not waste doses in this community. That's not tolerable, and I know that the hospitals are on the same page with that.
Thank you.
Sure.
Melissa with Channel 13, please ask your question.
Yeah, hi, I'm going to want to expand again on what Bree just was asking about, because feasibly, we can see a scenario set up here where we've got some people in the 80-year-old range trying to sign up and they can't get an appointment. So then what do you tell them? I mean, do they keep trying back, or do they automatically get put on a waiting list? This is going to be an important distinction, I think, for every age group.
So what we're going to do is there's the ability to be put on a wait list through possibly area office on aging. The idea here is to do the pre-registration as well too. They'll help you get onto that website. So it's that pre-registration which is going to be able to go ahead and help us as well too.
I'm sorry. So you are going to keep a waiting list from the people who can't make an appointment?
So,
Like, you can see where this is going to be something that they're going to ask.
So again, that pre-registration that we put out last week is going to help us, okay? But they're going to have to keep on coming back to that list to see if, or excuse me, to that link to see if they're going to be able to get scheduled. So again, we're going to try to knock down as many barriers as possible.
Okay, thank you.
That's fine.
Caitlin with the Blade, please ask your question.
Hi again. So we've been striving for this 70% vaccination in the community to reach herd immunity, but we know some folks eligible to receive the vaccine in phase 1A have already declined it. Do you think that we're still on track to be able to reach that 70% number?
You know, I got to tell you, I think it's too early to predict that, just because, again, of the vaccines that we have, the amount of vaccines we have. I will say that we're probably right now closer to that 50, mid-50 area. Again, if you look at each one of the entities that have gotten vaccines, I will tell you this: we're hearing these anecdotal stories where people are now seeing that the vaccine, you know, really isn't as bad as people were making it out to be. So these individuals now want to come and get vaccinated. The problem is, again, we've now moved on to this 1B, and those are all the doses that we have. So when can, again, that 1A be reopened? So again, we do still have some 1A vaccine in the community, and I urge individuals to go ahead and again, try to go ahead and make sure you reach back into your employer who still might have some of that 1A, the hospitals, to go ahead and get vaccinated.
Amy with Channel 11, please ask your question.
So I heard Bree ask at the beginning, and you say you had about 44,000 people in the county who filled out that initial form online just showing interest in getting the vaccine. Do we know how many of those people are in this phase of 1B?
It is north of 24,000 for 1B.
Thank you.
Sure.
Bree, go ahead and ask your question.
Another follow-up, Eric. So of that 24,000, do we have a number on how many will be allocated for the 1B yet, or is that something that is kind of changing all the time? And then will there also be, you know, are these dates going to change if you aren't able to get enough of the, you know, 80-year-olds for that first week? Are you still going to transition to the next age group? Or is that going to depend on the number that's coming in?
So we'll immediately transition into the next age group as we go through this. So I do not believe the governor is going to change that. He could. So you can see how this is going to work. We're going to receive, you know, 6,000 doses. You know, we probably have many more of those 80-year-olds who might want to get that, and then we're going to have to move into 70, and then keep on cascading down. And I'm sorry, what was the other question? Then I do apologize.
If we knew a number of how many doses, you said it'll be in the hundreds, not the thousands, if we had an idea of what that number would be yet.
Right now, again, we're pretty lucky for this week. We got about 6,000 doses that are going to be in the community. The idea is to, again, get them out as quick as possible. The reason why we've kind of split this up too amongst hospitals and other entities, again, I want to make sure that the community understands that we're trying to knock down as many barriers as possible and get as many people as vaccinated.
Okay, thank you.
All right, so I do believe that there are no more questions. And again, I really want to thank all our partners in the community. But I do really want to, thank all those who have been working tirelessly over the last couple of days to, again, pivot to this new plan and to get the vaccines out. So again, please keep yourself healthy, get vaccinated when you can. And again, wash your hands, wear your mask, and social distance. Thank you so much.